Maureen O'Sullivan.
Gormaglas Ken Corla. I do spoil my hand as a hurt than a buntosh the agus the nuddy jarfuck I thought went to Sheriff Sloinche. And I think it is important to acknowledge the positive and the progress that has been made. And what I want to acknowledge tonight is the palliative care that is available to people here. I just had experience of it there before Christmas and it was an excellent service. Waiting lists are improving, but the difficulty is now that while people are getting the initial appointment quicker, the delay then starts, and I'd love to see the statistics on that from the initial appointment until when they actually get the appointment for the operation or the treatment or the occupational therapy or the physiotherapy or the detox bed or presenting with an eating disorder or a mental health issue. Before Christmas there was a briefing given here by the Director General of the Health Services, and I was one of 3 TDs who attended that, which was excellent for the 3 of us because we had real one-to-one engagement. Now it was very obvious looking at the plan that there are challenges and there are reductions, and it's difficult to see the match between the requirements and the increasing demands and the resources and the funding available. And it's happening today when private health insurance, there's a further increase, so that's going to see more demands on the public service. There's just a couple of particular examples that I think show that we're very far behind, and one is to do with CAMHS. I'm hearing from schools and from doctors who are making referrals of young children to the Child and Mental Health Services, and they're being refused. They don't make those referrals lightly. So I don't know, is it a resource issue or are the criteria changed? But certainly there are an awful lot more refusals, and there is still a big gap for those presenting with issues like that from in the 16 to 18 age group. Diabetes is an area in our medical system that doesn't get very much attention. But I think there is a need to look at those presenting with chronic diabetes in a much more holistic way. So if they come into an A&E or a hospital with a problem with a kidney or a heart, that it's not seen in isolation from the diabetes. And again, I'm hearing from people who are grave difficulties because they have chronic diabetes. The same with stroke victims. While the therapies are good, there can be shortfalls in the medical care. And just I want to make one plea regarding the service plan in relation to substance misuse, that all of the local knowledge and the initiatives that have been built up in the communities most affected by the drugs and the drugs issue, that's not going to be lost, and that there will be support to drug recovery and accommodation. Separate those in recovery from those who are actively using. In the government amendment, there's a commitment to patient safety, but I came across a very, very serious incident recently of a young woman delivering a baby in one of our maternity hospitals who was sent home, obviously, came back on 3 occasions because she continued to bleed in the course of 10 days after having the birth. The 3rd occasion, it was eventually discovered what had happened, what the cutting had happened during birth, and the extent of the loss of blood. That's not patient safety.